Hi everyone, so today I want to talk about a really interesting patient that I am about to do. So this patient, 5 years ago, decided that she wanted to have some abdominal contouring done. She wanted a tummy tuck. The problem was that she is 5'3", and at that time she weighed 240 pounds. And unfortunately, she found a surgeon that was willing to do her with that size. And what happened was the surgeon began the tummy tuck, and as soon as he made the incision and got down to the muscles, he aborted the procedure because he told her that she had a vascular abnormality and her blood vessels were 3 to 4 times their normal diameter, and he didn't feel it was safe to do. Now, this is not a vascular abnormality. That is normal in patients that are morbidly obese, and she was, with a BMI, body mass index, of almost 40. So this really stresses the importance, and it's really the obligation, the ethical obligation of surgeons to recommend weight loss to patients when they're obese, because number one, the risks are not worth the surgery, and number two, the results are not good. Body contouring procedures are procedures that are designed for people that are close to their ideal body weight. So after that failed tummy tuck, she went and she had a bariatric surgery done. She had a gastric sleeve and lost 90 pounds. And here is what we are left with. So you can tell that she has a severe amount of loose skin all over her abdomen, not just in the upper abdomen, but in the lower abdomen as well. You have an old C-section scar that you can see is deforming the abdomen because that scar is stuck down to the muscles, and this severe amount of loose skin has now started to hang over it. And what you don't see here is a scar that she has from hip to hip from that failed tummy tuck. So the plan today is I'm going to excise that scar, I'm going to release all of the internal scar tissue, and then I'm going to take off pretty much all of this loose skin. This is going to get pulled down to here. This is going to get pulled in this direction. So we should be able to leave her completely flat with a nicely contoured waist. We're going to do a little liposuction to give her better contour here. That skin is going to get pulled in. I'm going to give her her new belly button, which is going to be round and in the middle of her abdomen and with no loose skin around it. And then she does have a bit of a diastasis, as you can see here. So I'm going to tie those muscles together, and that's going to make her even flatter and firmer. So we will see exactly how big her blood vessels are when I operate on her. Okay, so I've lifted all the skin off of the muscles. I tied the muscles together. Her blood vessels were the normal size. They're always a little bit larger in patients that have lost a lot of weight because, as I mentioned earlier, the blood vessels dilate to get more blood out to all the additional areas of fat when you are morbidly obese. And once you drop the weight, the blood vessels do shrink down a little bit, but they usually stay a little bit larger. So it just takes a little bit more effort and care on the part of the surgeon to make sure that all those vessels are well sealed and that there's no bleeding after surgery. So you can see how much loose skin she had. I've freed up all of that loose skin, and now I'm going to stretch everything down. And you can see that she's going to come out really, really nice and tight and flat.